There are facts straight. Face masks aren't that useful. You might be seeing people wearing them, but there is limited evidence that they work. Face masks need to be changed frequently because they get sweaty. They are important to cover your mouth and nose while sneezing with a tissue or your elbow. Put the tissue straight into a clothespin. Wash your hands regularly with soap and water or sanitizer. Keep your distance from people who are coughing and sneezing, at least 1 meter. Don't bother eating garlic, gargling mouthwash, rinsing your nose with saline, using sesame oil under the nose. None of these will help protect against the new virus in any way, the World Health Organization says. You can't catch the virus from pets. There is no evidence that your pet dog or cat can pass on the new coronavirus, according to the World Health Organization. Most people will have mild symptoms, dry cough, high temperature, and will recover. However, the virus is making some people seriously ill and killing a small number, around 1%. The elderly, the unwell, and possibly men are more at risk of getting a serious disease. Scientists still don't know exactly how the new virus is spread, but it does seem to be very infectious. Tiny droplets from coughs and breathing are most likely. Doctors say so advising people with mild symptoms to self-isolate for 7 days is lowering that risk even further. Reducing close contact with people, particularly those who look unwell, is a good move too. There is no cure. There are no specific medicines or vaccines for the new virus, and antibiotics don't work either. They fight off bacteria, not viruses. Treatment options do exist, but most people get better on their own. Scientists are working hard to develop vaccine, but this will have to be tested in trials first, so it could be some time before it's ready. The World Health Organization says it is also safe to receive packages and letters from countries with coronavirus hotspots. The virus is unlikely to survive for long enough on these kind of surfaces, but it can survive on surfaces like door handles, cups, mobile phones, and money for days, potentially, which is why regularly cleaning our hands with soap and water is so important. You have to be in close contact with an infected person within 2 meters for 15 minutes or more to be at risk, according to advice from Public Health England. UK government advisor says it is more likely you will be infected from close family and friends than when attending a large gathering or event. The virus is now circulating widely within the UK, so health officials say that reducing social contact by working at home, avoiding busy public transport, and staggering your commute is a good idea too.